Thanks for joining us. Again, this is Adam Rosenberg from Baltimore Child Abuse Center. We've got a lot of people on the call today. More people join us for these stakeholder calls each time, and it's very encouraging to have the support and the opportunity to give you all an update, as you are all important stakeholders in our work throughout not only Baltimore but Maryland and beyond. If you just kind of follow along with me on the PowerPoint slides that PDF which Jenny sent out yesterday or today, I guess you got this morning. Check your mailbox. If you don't have them, I'll certainly describe what we have on there. I'm going to go through a couple things today. I'm going to give you a wrap-up as to how we did in Fiscal 14 and how some of the events in Fiscal 14 are beginning to shape what we're doing in Fiscal 15, particularly our work with children exposed to violence, our new work with professional development and training, and even some necessary building renovations that we undertook and then need to go the next level here. First, I want to tell you about how we did in Fiscal 14, and Fiscal 14 was unquestionably one of the best years that this agency has had in a very, very long time. As a nonprofit, it's certainly not an easy task to substantially grow revenue and to grow our resources while also continuing to serve people. But we did it, and we did it really in thanks to a lot of people who were on our side. Both in terms of philanthropy, in terms of our government support, and even our own fee-for-service work. We're proud of the fact, I'm particularly proud of the fact that we try and maintain a balanced pie so that all of our revenue streams are not dependent necessarily on one thing or another. 42% of our revenue over the last year came from a wide variety of philanthropic resources. Some of them are restricted gifts and some of them are unrestricted gifts. We've really made it a point to cultivate a new generation of donors and supporters and people who believe in our work to protect children, and the grants and the gifts have fortunately come along with it, which enabled us to do more work. Government continues to be a substantial portion of our support there, and we actually grew it in the last year, due in part to some nice grants that we got from Governor O'Malley's administration and office, as well as continued growth from the city of Baltimore. And we continue to provide our own fee-for-service. I think it's important that we provide some services that we are paid for or reimbursed for, which help underwrite the cost of just frankly doing business there. Fee-for-service was 26% of our budget with $544,000. Philanthropy was the largest portion at 42% with $879,000 raised. And government grants, both local and state, many of which were competitive in nature, yielded $667,000. Within that, what is fee-for-service? For a long time, we get a stipend from the Department of Health and Mental Hygiene. So for every sexual assault interview that we do, we get reimbursed a little bit of money. It doesn't nearly cover the cost of doing business. I think we've estimated that a forensic interview by one of our licensed social workers of a child who's experienced abuse costs probably about $1,000 per case. And we're only reimbursed for sexual abuse cases. We don't receive reimbursements for physical abuse, for domestic violence, for a wide variety of cases that we provide services for, but we do them because they're necessary. That said, we received about $217,000 in reimbursements over the last year for our forensic services work, which consists of a structured interview conversation with the child as well as a medical examination by our own pediatrician. We own our building here at 2300 North Charles, and if you haven't put it on your calendar yet, come by on October 8th for our open house from 5:30 to 7:30 p.m. You can come by and really see what we do there. It provides us with also a source of revenue from some agencies that we partner with who co-locate in the building. But the biggest increase in this pie here, we actually were reimbursed less dollars for forensic services than the previous year because we saw more cases which were not reimbursable. But we did about $100,000 worth of training last year. We were paid by several organizations. We received several grants to provide best practices work. And a little later in the call, in about 10, 15 minutes or so, I'll talk about what that training work is. But it's been critical, not only for our success, but in making the practice of protecting children better. The last little sliver on that pie talks about insurance billing, and even though it was only $2,457, it represents a future area of growth. And I'll say this for a future call, Population Health and the Affordable Care Act has opened up new avenues of potential support as well as potential opportunities for families and children who have been victims of abuse. There's the ability, frankly, for children to get mental health services that hadn't been there before. Every child in the state of Maryland has health care or has access to health care. And utilizing those relationships and those partnerships and even that system in the right way, we can make sure that we can get these kids help. I surmise over the next several years the insurance billing portion will grow in an appropriate but also sustainable level. Our government grants really come down, from two sources. The city of Baltimore currently funds us about $286,000 in grants. Much of it has been over the hard work of working with our city partners, so they have an appreciation for the work that we can do with them. And the state of Maryland provides us with 57% of our government funds. We like to say that the government investment, we multiply substantially. So if about a third of our budget overall comes from government funds, we provide the other two-thirds there to really make it something that is sustainable. So we are not completely reliant on government, but we're a partner of government there, and they're a partner of ours, and we always look to increase that. One of the challenges with government grants, obviously, always is the change in administrations. With new leadership coming in, frankly, at all levels this January 2015, it is something that we're keeping our mind on. So we're making sure that we're having conversations with legislators and conversations with everybody who's involved who, at a variety of levels of government, so they have an understanding as to the work we provide and the substantial financial savings that we provide as well. While there is approximately $500,000 provided by governments to BCAC, studies from the National Children's Advocacy Center indicate that we save over $1,000 per investigation per child, and that's of the $1,000 that, per approximately 1,000 kids we've seen, that's about $1 million saved for different jurisdictions there if we didn't exist. So it is a smart investment. Not just for the day-to-day work, but also for the long-term work with these children, that by investing in Baltimore Child Abuse Center and by government spending their time with us, we're able to maximize the work that can be done there. And frankly, some of the work is government supported and is done by governments in other jurisdictions. We really are the only standalone nonprofit child advocacy center in the state of Maryland, and truly the only 24-hour program of its kind on the East Coast. But we also provide things that governments wouldn't necessarily do. Our child-friendly space, which again you can see at the open house, our victim advocacy services, our mental health services, and these are things that governments would never be able to provide. The transportation services we provide families to get here, those are all the different kinds of programs that I think we bring to the table while government helps bolster up a lot of our forensic crisis services. Briefly, philanthropy. We had a remarkable year with philanthropy, due in part to many people pitching in and helping out. One of the largest parts of our philanthropic pie were from our special events, and I really have to give the credit of that to our fearless leaders in that effort there, Jen Sachs and Colby Simon, who chaired our Be a Hero event, and our intrepid director of development, Jenny Trust, who also just got married. So just sending out congratulations to her on that. It's a great team that came together that ended up helping us bring in $220,000 from that event, and then there were other events that made up that $250,000 pie. But we made it a point to have not just a signature event that let the community see how they can protect themselves and protect children from abuse, but also to be a part of a larger conversation there. We fully intend on having another one. We are in the final stages of wrapping up the details. We're expecting it's going to be at the end of April. I think you could tentatively pencil in April 30th, 2015. There's no Orioles game that night, so there'll be no traffic downtown, and we will be the only event going on. So we hope you join us, and we'll announce our speaker soon. But we know this is, it's provided us with an important opportunity for people to give and partner with us that they hadn't done before. And so special events were really a critical role in that. And we had just a terrific committee who participated in it as well that are far too many to mention. It's an important part of development. The other parts of our philanthropic pie, almost $100,000 worth of people gave to Baltimore Child Abuse Center. I mean, we really worked an arduous annual giving campaign. We have a great campaign chair in Liz Ritter who worked with jtrust to help people give. Our workplace giving remains strong. We partner with United Way and obviously foundations. We write some really terrific grants that we're fortunate to get funded on a variety of levels, some of it restricted and some of it unrestricted. That makes up our philanthropic pie. What is it funding? Ultimately it's funding human resources. Page 6 of that PowerPoint we sent out talks about our expenses. We run a lean shop here. We're not making widgets. At the end, it's about the staff who does this work, who examines these children, who interviews these children, who provides the advocacy. And then we really try and stay lean and mean with everything else, our facilities, our program, our communications. The pie will probably change next year as I think we're looking at different categories to report out on our expenses. But nevertheless, it really comes down to, we're a human resource organization with, 21, 22 staff members now. We've grown, well over, both budget-wise and staff-wise, about 150% over 6 years. We're doing great things, and we need these people, frankly, to be able to provide a 24-hour continuum of care. And even then, there's still more work to be done. We hope that as resources grow and sustain, we're able to provide more advocacy, more mental health services as necessary for a population that's increasingly seeing the impact of violence upon children. Some highlights from that year, obviously talked about our Be a Hero event that we had raised over $220,000. One of the other highlights from the year, which will have impact for frankly, years and years to come, is our partnership with Sinai Lifebridge Hospital. As we've proudly reported in several newsletters along the way, we received a 3-year, $300,000 grant from a philanthropist who appreciates our joint work. We have a great partnership with Neil Meltzer and his team at Lifebridge. They believe that there's a medical responsibility that a hospital has to a population that's at risk. And by partnering with Sinai, not only has it paid for our doctor, but also provides a new medical home for those children so that we can make it's a very natural place to be able to make a referral rather than having to look through a network of people there. The hospital has the specialists to be able to help with the handoff and help with the transition, and particularly help in a community that, as we've seen in our numbers, has had more cases of child abuse than any other area of the city. It's really alarming, and maybe as a follow-up, we'll send out the zip code map. That over the last 3 years, the Park Heights zip code dramatically has more kids living there that have been victims of abuse than any other zip code in the city. And so Sinai being the leader in that community, all throughout the Park Heights Avenue, north and south of it, of Northern Parkway and their hospital, they know that they can do something about it. And so they can help with better medical connections. That partnership has also enabled us to open new doors. So starting in this new year, we're working with the Department of Human Resources Child Protective Services Division here in Baltimore for children who are entering foster care. There has been a longstanding ruling in Baltimore City governing a lot of the management of children in foster care. And one of the mandates of it, frankly, is to make sure that when children enter foster care, they receive a medical examination within 5 days of their entry into foster care. Baltimore City is the only jurisdiction in the state that manages this process. The other jurisdictions don't. And it's because of what's been known as the LJ consent decree, but has yielded many good results there. And one of them is this medical management of Renovations. For a long time, the MATCH program, Making All the Children Healthy, has looked to bring children back to their primary care provider. But frankly, they've had a difficult time doing that. Not for lack of their effort, they try very hard, but many of these children who enter foster care's primary care providers don't have the ability, the skill set, or even the time to see these children on such a quick basis. Initially, BCAC provided some relief to the MATCH program in that we had said if you get in a jam, call us and we'll see the kid. We've now flipped that and working, following I think some other protocols that function nationally. We're going to start being the primary care, the initial care provider for all these children who enter foster care who require a medical examination. That will increase our caseload here, frankly, by probably almost 600 children a year. But our goal is to make sure that every child who enters foster care gets a expert medical examination by our very qualified faculty, supported by Sinai Hospital, and within 2 days of their entry. And that's really, really critical. That will make for better health outcomes for those children and make sure that those children, frankly, are safe when they come in. Ultimately, working with a hospital is going to result in increased insurance revenue. Some services we function like a medical clinic here, and we should be able to act like a medical clinic. And so if there are services that are appropriately reimbursable under health insurance, then the hospital enables us to be able to increase that revenue as well, to make the medical program self-sustaining. Children, families, victims will never have to pay for their own medical examination at this stage in the state. It's just the laws are set up that way, and we believe fundamentally that people shouldn't have to be impacted by that. But if other services are offered or provided, mental health services, medical services, we should be able to treat it like a medical situation and condition and use that to help sustain the work there. There will always be exceptions. There will always be need for philanthropy to cover the cost of co-pays or people who are uninsured. But it's essential that we can find other ways to grow what we're doing here. The last highlight from 14 that steps over into 15, and we'll talk about so our highlights in 15 is professional development and training and technical expertise. In 14, we trained over 2,000 staff members at Baltimore City Head Start, a variety of summer camps, a number of youth-serving organizations. Those 2,000 staff members, frankly, supervise probably close to 20,000 children. And when we work with them to help them minimize their risk of abuse, then the children in their care are safer. By working with them, frankly, it opens new lines of communication. So their staff is more in tune with recognizing if abuse occurred. And as one anecdote, after our summer camp trainings, which were generously supported by the Zimmerman Fund and with support from the Associated and the Meyerhoff Fund, we had camp directors calling us within 2 hours of camp opening because children were arriving there and reporting abuse. Not abuse from the camp, but abuse that occurs in their home situation. And camps were able to most appropriately react and respond to it. Other training that we've been doing have come from several branches of the governor's office, Governor O'Malley's administration, which is helping provide better information for our teams, for police officers, for teachers, for social workers. You can see some of this on our website, and that web address is there. It's bcaci.org/professional_development to see our schedule and even some of the videos that we produced in this series, which help people do that. Looking ahead, some of the things we talked about. Slide 9 talks about childhood exposure to violence. This is really a critical area that not only our organization but all child advocacy centers are moving towards, frankly, over the next decade. We've established a very good model when it comes to interceding at an early point to help children who've been victims of abuse. But as we've learned from the Attorney General's Defending Childhood Initiative, of which I had the fortune of testifying in front of, and you can learn more about that at that website there, justice.gov/defendingchildhood. Children, when they've experienced adverse childhood experiences, such as witnessing violence, which could be domestic violence in the home, witnessing a murder, a robbery which occurs, those children are traumatized. And we have a large population of children here in Baltimore who are not just going through post-traumatic stress, but continuous traumatic stress because of the violent conditions that they're living in, whether it's because of not just domestic violence, but also sibling violence or other people living in the house. I mean, the housing systems in Baltimore are not necessarily mom, dad, and 2 kids anymore, but really there's a lot of families who are having new paradigms of how they live. And the cases that we've seen over the last year, when we've just dipped our toe in the water, have unfortunately been families who were staying with another family and violent violence occurred, where there's been murders and there's been shootings and there's been stabbings, and children witness this. Taking that knowledge, we were a large party to the efforts of the O'Malley Brown administration, and Attorney General Gansler was one of the things that these two foes in the primary campaign agreed upon, was we needed to be able to have better responses when children are exposed to violence, and we testified on that bill and passed this year. And starting October 1, that bill goes into effect, which provides, as we talk about on page 10, that there's an enhanced penalty for children when they've witnessed violence. So an offender, the prosecutor has the discretion to file these enhanced penalties, and an offender can be charged another 5 years of prison of that. We're planning on collaborating with the police department. They recognize we do a great job talking to kids, and they want our help talking to the kids who witness these violent incidences as well. And national best practices and the findings from both the Adverse Childhood Experiences as well as the Defending Childhood Initiative really demand that we interview those children there. So we're going to offer all of our services for those children, our 24/7 interview program, medical help, mental health, advocacy, everything that we do. House of Ruth, I think, will handle a lot of the primary advocacy for children who witness domestic violence. But as I've alluded to, and as we've studied, many of these cases are not domestic violence situations. Domestic violence really deals with intimate partner violence. And if 2 people, adult siblings, for example, live in a house together, and one of them ends up abusing the other, that is not considered, for the law, necessarily domestic violence. So that's where we're going to help for those cases where these other children see these things. We think that's another 400 to 600 children. And when we look at it at the end of next year, we may be looking at almost seeing 2,000 children here at the center, which is a substantial number to take on, but we believe we can do it. We wrote the grants for a variety of offices to be funded to be able to do that work. We're taking it on as our mission, and we've received some funding to be able to be there. Briefly, on slide 11, we talk about training. As I mentioned before, we have a number of training offerings there. This really is a byproduct of our 2013 strategic planning process, and we make it a point that we're bolstering our team and our agency's profile by having better prepared professionals. As a part of this, we've created a whole new department here at Baltimore Child Abuse Center. Our own Ruby Nelson, who is was our director of mental health, is supervising this, but really our whole staff is sharing in the effort. We'll be offering CEUs. We'll be offering 3 classes for our multidisciplinary team to make our police officers and our social service workers better informed in this there. And that will ultimately culminate in a website relaunch towards the end of this calendar year, as well as a mandated reporting website next year. There's a calendar of upcoming trainings on page 12, and certainly we're always available to do some specialized trainings if you're interested. And lastly, on slide 13, we're doing some building renovations, and I intentionally did not put pictures in it to entice you to come see what we've done with the building. We needed to expand our space in here. We're busting at the seams. And we received some nice grants from the Governor's Office of Children and a variety of foundations, which helped us do some capacity building to buy new furniture, knock down some walls, create some new offices, so that we have an expanded weight room, so that there's a child area and an adult area. Formerly, everyone had been sitting in the same room. It was small, it was cozy, but we needed the space, frankly. And what that did was, move staff to other parts of the office. But it's worked out, and frankly, the room looks terrific. So come by and see it on October 8th. We're also, as we're renovating the building, we have space available for the family crimes unit here. We're just working with the police on how to co-locate them and get them in here. And we're taking concepts from the Family Justice Center model as well, so that we can be of most help to people that are out there.